For me, I think what I want the community to know right now is like that I understand that you are very tired. And I think that I can speak on behalf of everyone at the health department when I say we can totally relate, because we are also very tired of COVID. But I also want the community to kind of, be able to remember some of the things that we were seeing and doing at the beginning of the pandemic, and be able to reapply those now. So we're seeing these really high rates of cases, and that to us at the health department is very concerning. And I think to us as a community is also very concerning. And I'm not telling everybody to panic and go back into this mode of fear, but also to remember the things that we already know, that if you're not vaccinated, now is the time to get vaccinated. It is not too late. The benefits of the vaccine are very strong, and the level of protection that it provides is very strong. And what we're seeing is we're seeing high numbers of people who are unvaccinated dying from COVID-19. And in spite of the concerns that some have about the vaccine itself, we're not seeing high rates of people dying of the vaccine. But also just remembering the strategies like masking and social distancing, and that now is the time to kind of remember those. And in remembering them, hopefully we can continue to carry out in our normal lives and not have to go back into this phase of shutdown, because I think we all agree that is not where we want to go. So that was a little lengthy, but that's like kind of my thoughts and what I want to communicate to the community right now.
That was great. Thank you so much for sharing that. So I'm hearing just paring it down, back to basics. Going back to what we know will help to stop the spread of COVID-19 in our community. So it's an excellent message. Thank you. And Dr. O, what are your thoughts on how are we going to get out of this? How are we going to get through this pandemic and finally get to the other side at some point? What will it take?
Okay, it's a straightforward scientific question, but because of the way COVID has become in the United States, it takes on a philosophical, political tone, which I will not touch. I will rather just stay on the philosophical. Public health, the reason why we exist as public health is, and why public health is a governmental duty, is because we know from millennia of history that the government, the people have to do certain things to keep the society from collapsing. And some of you that work in RHA have heard me give some version of this talk. The Black Death in the Middle Ages in Europe is estimated to have wiped out 70 to 90% of the population of Europe, and it is believed to have held back the entire humanity by 200 years. So the internet could have been discovered 200 years ago if all the people that died from the Black Death hadn't taken all the knowledge with them. That's why we do public health. That's why we do the things we do. And so if we think like that, if we think that the things we're asking to do, the reason for the existence of public health, the reasons we inspect restaurants, we insist on certain vaccinations before you go to school. It is so that the society, not the government, so that the society we live in does not collapse. And that would be what it's that understanding of public health as a societal, not a governmental function, that I think will help us out of this, where we get leaders that begin to, and we all are leaders, right? So I'm not necessarily talking about governmental political leaders, but all leaders begin to talk and understand and communicate the importance of public health and this once in a lifetime public health crisis as something we need to do and we need to control to keep our society from collapsing.